After 30 years in spine surgery, what still makes a neurosurgeon stop and pay attention? Innovation doesn't happen because physicians want something new. It happens because they believe patients deserve something better.
This is Dr. Joseph Aferzon. I'm a practicing neurosurgeon out of Hartford, Connecticut. I have been in practice over 30 years. I'm very excited to talk about endoscopic less invasive decompression. We just finished working on developing and on understanding the technique. It makes decompression safe, reproducible, it's accessible to neurosurgeons, orthopedic spine surgeons, and pain doctors. This is a clear innovation over the standard traditional techniques of decompression.
The future of spine innovation isn't measured by how different a procedure looks. It's measured by whether experienced physicians believe it can be reproduced safely across real-world practice.
This procedure would involve much smaller exposure, smaller tissue damage, preservation of vital structural parts of the spine. The goal is to reduce pressure on the nerves. These techniques offer patients a safer decompression, quicker recovery, and potentially will avoid the need for fusion in many cases.
Every advancement in spine care begins with one question: can we preserve more while helping patients recover better?